So mobile bearing knee arthroplasty. People who talk about mobile bearing enamored the people like you with graphs like this. We show contact stresses, contact pressure, contact area, and a lot of things given as an argument for using mobile bearing. But what is this mobile bearing knee? Mobile bearing knee arthroplasty is a loosely connected multiple designs, very complex ones, which has got significant changes from one to another. There are different types of rotating meniscal bearing, floating platform things. The constraint level varies, the mobility amount varies. It could be rotation, rotation with glide, rotation with AP and mediolateral dimension. The upper surface geometry varies between the different designs, and mediolateral flat on flat or flat on curve thing also varies with different designs. So it is basically mobile bearing TKRs are actually like a basket of fruits. A surgeon may try to eat a banana or may try to sample an orange from the basket and then try to tell you that how an apple or how a melon will taste based on his experience. So what are the perceived benefits of mobile bearing knee arthroplasty? Better kinematics, better range of movement, resemble like a natural knee, less wear, tibiofemoral malrotation friendly. It feels more natural in a patient and it lasts longer. Let's see whether these allegations stand truth of time on literature. Better kinematics, 12 different mobile bearing implants were compared, and they found that among all these different designs, the rotation and kinematics of the poly insert is not predictable among all of them. It is different for different designs. They compared Zimmer and Depew, one of the two commonest designs which are used in India and maybe in US, and they found that the mobile insert movement is not predictable. It is different in the two things. Does the better kinematics result into improved range of movement? There are n number of studies which tell you that there is no difference in the range of movement between the mobile bearing and a fixed bearing design. It resembles like a natural knee. Study from Chateau from knee in 2009 have mentioned that tibiofemoral kinematics in mobile bearing TKR does not replicate the normal knee, because basically you are removed both the cruciates, so it cannot resemble the normal knee. Another study from Japan in Journal of Orthoplasty have mentioned the fluoroscopic study of weight bearing knee. They compared normal mobile bearing and fixed bearing knee and came to conclusion that kinematics is different than the natural knee. Does it wear less? Well, in vivo studies by Eng, published in Journal of Orthoplasty 2009, retrieved implant study, they mentioned that upper surface wear is more burnishing seen in mobile bearing than in fixed bearing, and under surface there is 3 times more scratching and burnishing under the mobile bearing insert. And from Garcia also I mentioned that posterior mobile bearing surface is an additional source of polywear, and implication of that has not been fully studied yet. In vitro study have mentioned that wear is similar in both of them, and this 4-station force control simulator study have mentioned that wear debris morphology, which matters about how much osteolysis or how much synovial reaction can happen, and the gravimetric wear rate is more or less similar in both of them. Is it more forgiving on tibiofemoral malrotation? If your femur is malrotated compared to the tibia while inserting it, the patellofemoral and tibiofemoral shear forces are still high. Rotating platform tibia does not compensate for tibial or femoral malrotation, so you still have to get your tibia right. Just by using a rotating platform doesn't get you out of the soup. Do the patient feel natural with mobile bearing knee? This is a patient reported outcome published by Learmonth in JBJS 2008. They randomized the replacement surgery after the femoral bone cuts were taken. So surgeon did not know what implant is going to put till everything was done in the end. And they found that at 2 years, there was no difference between the two knees as felt by the patient themselves. Compared to the mobile bearing knee, the long-term outcome, no difference. Many studies are there. All these studies in big and standardized journals, JBJS, Arthroplasty, Acta, Orthopaedic Belgica, JBJS again. And this is a meta-analysis where 5,000 plus citations have been studied, and they compared for knee society score, range of movement, pain score, radiology, complication, and patient preference. There was no difference in mobile bearing and a fixed bearing, and the article is in Orthoplasty 2009 again. Does the outcome change in longer follow-up? Well, this is probably the best I could find, the longest follow-up as a comparative study by Kim. 146 patient, one knee is mobile bearing, other knee is fixed bearing. There can't be any better comparison between the two of them. And they realized that there was no difference at 13 plus year follow-up in the outcome. Neither was there is increased risk of revision in a fixed bearing knee. On the other hand, also risk of spin out, almost 3.5% risk has been mentioned, and Bhende et al. Have also mentioned in arthroplasty that they should not do mobile bearing in a severely deformed knee, and this is which you are going to face in our Indian scenario. We have done more than 400 mobile bearing knee, RP and RPF type. We used Dr. Ranawat's balance technique. We haven't found instability as a major problem, but still we had 3 knees and there was one dislocation which was post-traumatic. So, the bottom line is a knee arthroplasty is a knee arthroplasty. As far as you can get a good alignment and a good soft tissue balancing, you will get a good outcome. Let it be a fancy mobile bearing prosthesis or a simple age-old fixed bearing implant, it still works the same. So it is like drawing a picture of a dog. You may want to make it look very interesting and exciting for people, but it is still a dog. And that you can realize if you see how that dog is drawn. The way you can draw a dog to make it look exciting, you know. That's dog, don't worry.